Hello and welcome everyone today to this exciting breathlessness management talk. Now this is such a big topic for all of our patients because your number one symptom is that breathlessness. Now this talk is going to aim to help you deal with that breathlessness management better. Now what we're going to learn today is that we're going to learn a few breathing techniques that will help when you get really out of breath. We're also going to make you aware of a new bit of research, an interesting bit of research with fan therapy, and then we're going to finish off looking at positions of ease. So let's kick things off with what breathlessness is. Now everyone in the world will get breathless at some point. Within the exercise class and home programs, we aim to get you breathless, but we're doing this in a safe and controlled manner. This presentation provides information for when this breathlessness feels out of control and we are struggling at getting air in and out of our lungs. Again, this paragraph highlights the breathing techniques we will learn today. Now, my top tip and take-home message is to practice these techniques when you are not breathless. This is because when you become breathless, these techniques will become second nature to adopt and help to bring that breathing rate back down to normal ranges. Now, these exercises can be done during exercise within our exercise programs, during activities that you're doing around the house, or also when you suddenly get out of breath. The first technique is active cycle of breathing technique. Now, for many of our patients with lung conditions, you have more phlegm on your chest than usual. This is particularly the case for our COPD and bronchiectasis patients. Now, this phlegm can sit on our chest and causes blockages within our airways, making it harder to get air in and out of our lungs. It's important to remove this phlegm from our airways to help us breathe. This is where active cycle of breathing comes in, which loosens up this phlegm and gets it out of our lungs. Active cycle of breathing has 6 steps that must be done and repeated. Step 1 is breathing control or normal relaxed breathing. This should be done for 1 minute. Step 2, take 3 to 4 deep breaths with a 3-second hold with every in-breath. Step 3, we are back to that breathing control for 1 minute. Step 4, we need to repeat those 3 to 4 deep breaths again. Step 5 and 6, we're going to finish with a big huff and a big cough. Please see the next slide, starred by myself, for a video demonstration.
Do a cough.
So at the start of the video, I was demonstrating breathing control. Now, unlike the video, when practicing at home, you want to do this for 1 minute at a time. Notice from the video how my shoulders and upper chest are relaxed, and there is very little movement coming from these areas when taking breaths in and out. You want to take gentle breaths in through your nose and out through your mouth. With every out-breath, we are trying to release more and more tension and slow your breathing rate right down. A tip to help you could be to close your eyes and focus your attention on the process of breathing and relaxing your shoulders. Now, I just have a few tips for you on this slide so that when you are practicing at home, you adopt the correct techniques. So for your deep breaths, you want to keep your shoulders nice and relaxed, and then on each in-breath, you want to hold for 2 to 3 seconds. Now with a huff, it's a strong exhale through an open mouth and throat. It helps to move the phlegm up your airways so that you can clear it in a more controlled manner. And a top tip is it is like you are steaming up a mirror or your glasses. Now there's two types of huffs. There's a short one and a long huff, okay, which is just elongating this sort of exhale out. Now with a cough, you should only cough when your phlegm can be cleared easily, and you should avoid bouts of coughing, as this can be very tiring and it could actually add to your sort of breathlessness as well. For those that do produce a lot of phlegm, the next question is, when do I do active cycle of breathing technique? Now it should be done first thing in the morning, but first we want to take our blue inhaler, then do active cycle of breathing technique, then take your preventer inhaler. The reason we take our preventer inhaler after active cycle of breathing technique and not before is that if we took our preventer inhaler before active cycle of breathing technique, then we would cough up some of that medicine in our phlegm. This medicine we want to keep in our lungs. The next exercise is pursed-lip breathing. It can be used anytime to help control our breathing and is a great way to help you recover from physical exertion. To do this, breathe in gently through your nose and breathe out with pursed lips, as if you're whistling or blowing out a candle. Blow out as long as comfortable. Do not force your lungs to empty. We do this to try and bring our breathing rate down and helps make your breathing more efficient. Please look on the next slide for a video example. The next exercise is called diaphragmatic breathing. Now to start this, you want to start in lying, head slightly raised and knees bent. Place one hand on your upper chest and one hand on your belly. Relax your upper body and shoulders. Breathe in through your nose, breathe out through your mouth. With every in-breath, you want to breathe into your belly, expanding it outwards. 70 to 80% of the movement should come from your belly. Once you're getting around 70 to 80% of the movement with your belly, you can progress to sitting and standing positions. So why should we use diaphragmatic breathing? Now with these long-term lung conditions, we stop breathing with our diaphragm and we start breathing with our upper chest and shoulders. This means we can't get as much air into our lungs and increases our breathing rate. Diaphragmatic breathing increases the amount of air we can breathe in and reduces this breathing rate. Now to master this exercise, it should be done 2 times a day for 10 minutes. Now the last exercise I'm going to teach you is called blow as you go. It helps make tasks easier around the house and it can also be used in the exercise class. Breathe in before you make the effort, then breathe out while making the effort. It can be used when stretching your arms above your head, reaching for something on a shelf, bending down, going up a step or a flight of stairs, standing up. Now the video to the right demonstrates this exercise. Now I'm breathing in while I'm bending down to pick up the weights, and once I've picked up the weights, I'm breathing out through my mouth. Now the next thing I want to talk about is a new bit of research, and it's called fan therapy. Now it's been shown that the cooling sensation of a fan against your mouth, cheeks and nose actually can help to reduce breathlessness. It does this by sending a message to your brain to slow down that breathing rate. A very important question is, how do we use this fan to get the biggest benefits from it. Now, first off, we want to adopt a position that eases your breathlessness. We will talk about positions of ease later on in this presentation. You want to hold the fan about 15 centimeters to 6 inches away from your face, and you're aiming the draft of air towards your face, and you're moving the fan from side to side, making sure to hit your nose, mouth, and sides of your cheeks. This should be done until your breathing has eased. Now, one of the biggest questions is, how is this fan therapy going to help benefit me? How is it going to impact on my breathlessness and overall quality of life? So let's have a look at that in this slide. Now, it's been shown to help relieve breathlessness at rest. So for example, if you're watching the telly or you're reading a newspaper and you get a bout of breathlessness that is uncontrollable, you can get your fan out and it can help just bring this breathing rate back down. It's been shown to help with recovery time from exercise or tasks around the house. This means that you are able to do more and with an increased amount of confidence when doing household chores. It's also been shown to help with walking distances. So with this fan therapy, you're able to walk further, and this increases your confidence with going to the shops or meeting up with friends and family. Also, this fan should be used when you get that bout of breathlessness, and it's been shown to really help just reduce that breathing rate back down. Now I'm going to talk about positions of ease. Now, I highlighted these in a previous slide, and what they basically do is that we can adopt positions that again will help bring this breathing rate back down to normal. We have 3 positions that I want you to have a look at and then also try when your breathing gets out of control. It is the sitting, leaning forward at a table, it's a controlled flop, and it's also a stand leaning forward. Now, these should be adopted when you get those bouts of breathlessness that are uncontrollable and it feels that you can't get that in-breath. Now we're on to the most important slide of the whole presentation. If you only remember one thing, I want you to remember the 3 F's. Now, this should be adopted when your breathing rate is out of control and you're really struggling to get that in-breath in. It should be done when you're in high anxiety and you are panicked. Now, the 3 F's are slightly different depending on if you have an obstructive condition or a restrictive condition. Now, obstructive conditions like your COPD, asthma, and bronchiectasis, what I want you to do when you get that bout of breathlessness is reach out, grab for your fan, go into a position where you are in a forward lean and focus on your exhale breath. Okay? What this basically means is that for your exhale breath, you want to adopt pursed lip breathing, which I talked about earlier on in the slides. Now, for your restrictive conditions, which includes things like your pulmonary fibrosis, you want to adopt slightly different things within this framework. So here you will reach out, you will grab your fan, but for your position of ease, you will go into a flop position. Here for your breathing, you're just focused on relaxed breathing, okay, which is similar to breathing control, which I taught you in that active cycle of breathing technique. For the last slide, I just want to highlight our amazing website again. So you can go onto this website and find more educational videos as well as some other great content. So if you please just see this slide and go check out the website.